This is Robert Yoder from Grelot Physical Therapy, and today I want to talk about the resting jaw posture, which can be really helpful for patients with temporomandibular dysfunction, TMD, or sometimes called TMJ. And what we find a lot of times is that people with TMJ, they do a lot of unnecessary motions with their mouth that they may not realize. They may move off to the side. They may protrude their jaw forward, and a lot of times they're doing this unconsciously without thinking about it. And one of the big reasons for this is where their tongue is placed and how they hold their jaw. So I'm going to teach you the correct way to hold your tongue and your jaw. If you imagine normal jaw motion at this joint here is kind of like a hinge. I've got my skeleton here, and so here you see the mandible, and it should just be hinging back and forth normally. However, when we take a really big bite or open our mouth really wide, the mandible will actually sort of come forward and slide forward out of place here. This is okay, it will pop back, but a lot of times patients with TMD will do extra motions that cause it to come forward more than necessary. So if you go ahead and feel your TMJ right there in front of the ear, kind of lightly, let's appreciate the proper motion by understanding what it shouldn't feel like. So if you open your mouth really wide, you should feel on both sides your jaw, your mandible popping into your fingers. That's what you don't want to feel. If you protrude, you should feel the mandible popping into both fingers. If you move to the right or to the left, you should feel the opposite side pop into your finger. And so those are all unnecessary motions. The tongue is the key to holding the jaw in the correct spot. So where the tongue should be is on the roof of the mouth, just behind the teeth. A helpful cue for this is to make a cluck with your tongue. And right before you make that sound, that's where your tongue should be resting, right there on the roof of the mouth. Put your tongue there and seal your lips, and then make sure that your molars have a slight gap in between them. They should not be touching. And if you have your tongue on the roof of the mouth, lips are sealed, molars are open, and just take a few deep breaths using your diaphragm, you should feel a lot of that tension in the masseter muscles start to relax. So do that and see how that helps you. After you've taken about 6 deep breaths and you've kind of starting to feel what the relaxing jaw position is, let me show you the difference in how that affects your jaw motion. So put your fingers back there, put the tongue on the roof of the mouth, keep the tongue on the roof of the mouth, and start to open just until the tongue starts to pull off the roof of the mouth and then come back shut. If you do that, you should feel hardly anything in the TM joint, which just means it's just a pure hinge spin here. So just to recap, tongue cluck, tongue on the roof of the mouth, lips sealed, slight gap between the molars. This is the proper resting tongue and jaw position. It takes a while to get this muscle memory ingrained in us. So what we tell our patients is every time you go to the restroom, wash your hands, look in the mirror, and put the tongue in the correct spot and practice this about 15 to 20 times. And we see a lot of improvement in our TMD patients when they can finally achieve the proper resting jaw position and have the tongue act as an anchor to keep the jaw from protruding forward. It keeps it set back where it should be. So thanks so much for watching, and I hope this helps some of your problems. Thanks.